Hello everyone, myself Dr. Srikanth. I have done my MBBS from Usmania Medical College, Hyderabad. I have done my MD General Medicine from Rangaraya Medical College, Andhra Pradesh. Currently, I am a final year endocrinology super-speciality resident. I will be finishing my super-speciality in a few more months. In our medical field, the number of seats are increasing each year, but are the teaching standards increasing at the same pace? In today's fast paced world, the classic chalk and talk type of teaching has been slowly replaced by PowerPoint presentations, where hundreds of slides are covered in a matter of 1 hour. Fast learner can grasp some content, but what about the average student? Average students are not weak. They need some explanation. They need some clarity. They need some time and they need some repetition. Average students require some help, not just reading out PowerPoint presentation slides. Today, conceptual teaching is often available on coaching platforms, and not everyone is in a position to afford them. So, I'm starting a new YouTube channel focusing on the average student. I will give you an example of different types of teaching methods like the PowerPoint based teaching, the PDF annotation method, and the classic chalk and talk. I would like to listen to a lecture when it is chalk and talk or PDF annotation type rather than just simple PowerPoint presentation. So, as an example, we shall discuss a very simple topic, the diagnosis of diabetes. I will explain this small topic in three different styles. You can just tell me which style is suitable for the student in the comment section. So first, we shall see the PowerPoint presentation style. The topic is diagnosis of diabetes. Criteria for diagnosis of diabetes: HbA1c should be more than or equal to 6.5% or fasting plasma glucose more than or equal to 126 milligram per deciliter, where the ideal fasting time is at least 8 hours, or 2-hour plasma glucose after OGTT is more than or equal to 200 milligram per deciliter, or an individual with classic symptoms of hyperglycemia or hyperglycemic crisis with a random blood glucose of more than or equal to 200 milligram per deciliter. Any two out of these four should be positive for the diagnosis of diabetes. This is the PowerPoint style presentation. And now we shall see the PDF annotation style. The same topic, diagnosis of diabetes. Diabetes is diagnosed when the A1C is more than or equal to 6.5% or the fasting plasma glucose is more than or equal to 126 milligram per deciliter, where the ideal fasting is at least 8 hours, or the 2-hour plasma glucose is more than 200 milligram per deciliter after OGTT, or an individual with classic symptoms of hyperglycemia or hyperglycemic crisis with a plasma glucose of more than 200. So, any two out of four should be positive for the diagnosis of diabetes. Now, we shall see the classic chalk and talk type of teaching. Diagnosis of diabetes. HbA1c more than or equal to 6.5%, fasting blood sugar more than or equal to 126 milligram per deciliter, ideal fasting 8 hours, 2-hour plasma glucose after 75-gram OGTT, oral glucose tolerance test, should be more than or equal to 200. Keep in mind, it is the 2-hour value, not 1-hour value. Or a person with random blood sugar more than or equal to 200 milligram per deciliter plus symptoms of hyperglycemia like polyuria, polydipsia, etc. So, you diagnose a patient with diabetes when HbA1c is more than or equal to 6.5 percentage or fasting plasma glucose more than or equal to 126 milligram per deciliter and ideal fasting time is 8 hours, or the 2-hour plasma glucose should be more than or equal to 200 after giving 75-gram OGTT, or random blood sugar more than or equal to 200 milligram per deciliter plus symptoms of hyperglycemia like polyuria, polydipsia, etc. Out of these four, you need at least 2 out of 4 positive to call it as diabetes. So, this is the classical chalk and talk type of teaching. I have taught you the same topic in a PowerPoint presentation style, PDF annotation style, and the classic chalk and talk. Now, you tell me in the comment section which style is more suitable for students and which style is more comfortable for you. On this channel, I shall teach medicine in a simple, conceptual, clear, and structural manner. The teaching will be slow to benefit the average student. Fast learners can watch it in 1.5 or 2x. Any suggestions, please do comment in the comment section. If this sounds useful, kindly consider subscribing to the channel. Thank you for watching.